Hello PIA, this is Mike Becker, your Director of Federal Affairs here at the PIA National Office. A quick healthcare update for you. As you know, late last year, both the House and the Senate passed their own respective forms of healthcare reform. The biggest difference is that the House bill includes a public option, the Senate does not. The Senate bill includes an exchange-based system. Regardless of that, the Senate remains the chamber where the votes are the most critical. That's where they needed the 60 votes to pass the initial version of healthcare reform. Now, some of the moderate Democrats that supported that first version are saying they will not support a subsequent version that includes a public option or does anything like increases income taxes, or they even are asking Democratic leaders to keep whatever final bill comes out under $900 billion. Now, that's the president's ceiling that he laid out last September. The current House version exceeds that. The Senate version is below that. Now, in a typical setting, we would now have a conference committee. That's when you have a bill that's come out of both chambers, the House and the Senate, that are different. Now, this conference committee would include members from both the House and the Senate. They'd come together and they would work out their differences. Assuming they can work out their differences, they come up with one comprehensive bill which goes back to both the House and the Senate, and assuming that bill is passed, it then proceeds to the White House for the president's signature. Now, Democratic leaders have decided not to do that. They're working out the differences amongst themselves without any sort of involvement from the GOP. Now, a preliminary version of that bill is due out this week. It could come out tonight, it could come out in the next couple of days, but there are, regardless, a number of hurdles that could stall that and put us into the subsequent weeks. Now, when that bill comes out, again, it's going to go back to the House and the Senate. Again, in a typical situation, a bill like this would require 60 votes in the Senate to pass it. That's because 60 votes would ensure that any sort of Republican efforts to stall it or any efforts to kill it could be overcome. Now, the Senate's prepared to use a process called a reconciliation. That's where they would only need 51 votes. That procedure, the reconciliation procedure, is really designed to make deficit cutting easier. It's designed to be used with bills that are not going to be popular, such as tax increases or any sort of spending cuts, that type of bill. Now, again, the reconciliation process, it's really used for budget-related bills, so it's highly restrictive on the type of policy bills that can be passed through it. If they try to use this type of bill and they're able to pass it with 51 votes, it then goes to the Senate parliamentarian. Now, this one man would then be charged with going through the bill and looking for any sort of policy components of the bill that's not related to the budget and removing them. Now, if he removes substantial portions of this bill that the Democrats are not happy with, they could override that ruling, though they would need 60 votes to do so. So if it goes the reconciliation route, it's certainly not a done deal. It's possible they would need 60 votes. I would say that if it does go that reconciliation route, it's likely that the Democrats will have to scale back that bill greatly. And that's only if they aren't confident that they'll get the 60 votes to pass the bill in the first place to overcome any sort of Republican filibuster. But again, where we are right now is that the Democratic leaders in both the House and the Senate are working on one single comprehensive bill. They wish to come out with this bill and, if possible, pass it from both chambers prior to the President's State of the Union. That's now scheduled for January 27th. So we'll certainly keep you updated as things progress. In the meantime, visit us at www.pianet.com. Thank you.